All right, I'm going to talk a little bit here about interpretation of graphs. This, I can teach you some stuff, but basically it's going to come from practice, and we will practice them. When you're interpreting a graph, you're not just reading points off a graph, like, okay, this person's shoe size was this, their age is this. You're trying to make it so it's easier for people to look at your data as a whole. And so interpretation is not about just reading points or reading a bar. It's about trying to answer the question. Okay, are you answering the question that you developed? So you came up with you had an observation, you determined a question, you went through and developed a study, you got a bunch of quantitative data, numbers. Do those numbers answer your question? Okay, that's what we're trying to do. But I'm going to show you a little bit, and again, it's statistics, but I'm going to stay away from you doing the math and just show you what the statistics mean. All right, so this graph here is the mean heart rate of participants with standard deviation error bars. Okay, so it's the number of jumping jacks they did and what their heart rate was when they did the jumping jacks. So they probably wore a heart rate watch or a smart watch, and they were doing jumping jacks, and they recorded their heart rate while they were doing that. Okay. One of the things you have to do with statistics, and again, staying away from the math, is there's a way to determine how accurate your data is. Okay. How certain are we that your data is accurate? And that is dependent on many different factors. How many people you test, the variety of people you test, the variety of mice you test, whatever you're doing. Okay. I will tell you, the more people you test, the more accurate statistically your data is going to be. But what they will use is something called an error bar. So they took the mean heart rate, the average heart rate, and they plotted the point. And then they did a bunch of math, okay, which we're not going to get into. And they did what's called an error bar, okay? They did what's called an error bar. You're going to have to trust me with this, but an error bar just gives you an idea of, statistically speaking, how accurate is the data you collected. And again, that's based on a bunch of stuff, okay? So you'll see the error bar, here's the average, and then here's the error bar below, above and below, okay? So one of the things you're trying to determine is, let's just say you're trying to determine how many jumping jacks does a person have to do to get their heart rate to 130 beats a minute. And let's just say 130 beats a minute is what that person's heart rate needs to be in order to be considered to be working on their fitness level, okay? To be working on their fitness level. So if you're starting out with a new person and you want them to get their heart rate to 130 beats a minute, you don't want them to be doing more jumping jacks than they have to be. So how many jumping jacks do they have to be to get to 130, okay? So the question is doing 20 going to be enough to get them to 130, okay? And it's not, okay? It's not. How about if they do 25? Does that get them to 130 or above? Yes. But let me ask you a different question, okay? Let me ask you a different question a different way. Is their heart rate, okay, significantly higher doing 5 as opposed to 0, okay? And the way you tell that is it's statistically higher, okay? It is higher, okay? Their average heart rate is higher, but is it statistically higher? And the way you do that is you see whether these error bars overlap, okay? You see whether these error bars overlap. And actually, let's do a different one. Let's look at 5, doing 5 jumping jacks versus doing 10, okay? Is their heart rate significantly, statistically significantly higher doing 10 than doing 5, okay? And the answer is no, it is not. Their heart rate is not statistically significantly higher. How do I know that? Because their error bars overlap, okay? So there's inaccuracies in your statistics. And the way you run your statistics determines how much inaccuracy there is, okay? So the bigger your error bars, the bigger the error bars go away from your mean, the more inaccurate they are, the more uncertainty there is in the accuracy of your data. So here's the error bars for 5, here's the error bars for 10. They overlap, okay? So we cannot say, statistically speaking, that doing 10 significantly raises your heart rate more than doing 5. Okay? I know that sounds weird, but it's a statistics thing. So if I tell a person I want them to do the least number of jumping jacks to get their heart rate up, doing 10 is not going to make their heart rate go up any more than 5. I'm going to make them do 5 because I don't want to make them sore the next day. I don't want to make them unhappy because they have to do 10. Okay? So there's not a statistical difference between doing 5 and doing 10. If we go between 10 and 15, notice these bars overlap. There's not a statistical difference between doing 15 and doing 10 because these bars overlap. Now, is there a statistical difference between doing 20 and 15? Yes, there is. These bars don't overlap, so their heart rate will go significantly higher doing 20 than doing 15. Okay? And it's significantly higher between 25 and 20. The bars do not overlap. Okay? So again, I know you don't understand the math, but when you're interpreting a graph that has error bars, and they all don't, but if they have error bars, you can use those to help interpret the graph. Okay, so we did that. We talked about this. We basically went through this, so you can look at this and read this over on your own. Okay. Let's say we're going to, let's skip that one. Let's do this one. Okay, so this is a very typical study. Okay, so you're looking at medications versus a placebo. Okay, and what a placebo is necessary. Okay, it's necessary. If you're doing a drug study, I will tell you from years of research that people have done, if I tell you I'm giving you a drug, but I'm giving you a placebo, you will still see a response to that placebo. So if I told you that I didn't tell you whether you're getting the drug or the placebo, I just said you're getting one of them, but I tell you that the drug's going to make you happier. If I give you the placebo, which is not the drug, which is just a sugar pill, you will feel happier. Okay? It's just the way our mind works. New studies have shown that if I tell you, we're doing a study on happy drugs, and I'm going to give you the placebo, even though you know you're not getting the drug, you're getting the placebo, you will still feel happier. So our brain is a weird thing, and it's an amazing thing. But placebo is when you give somebody something that's not the treatment, okay? And we'll talk a little bit about that in class. So we've got 2 drugs, meth-P, and this is not meth, it's not the drug, meth-P and psilocybin. And I tell you that they're going to make you feel better, okay? So what we have to do, we have to run a study. We have to run a study that has a blind group. The blind group is going to be the group that's going to get the placebo. But we call it blind because they don't know they're getting a placebo. So we have a group that's getting meth-P, we have a group that's getting psilocybin, and we have a group that is getting the placebo. Okay, none of the groups know what they're getting. Okay, they don't know what they're getting. So that's a blind study. And to make it really accurate, we need to make it a double-blind study. And a double-blind study is the patients, the people getting the drug, don't know which one they're getting, and the person giving them the drug does not know which one they're getting. Okay, so we give these 3 groups. Okay, they don't know which one they're getting. They're either getting psilocybin, the placebo, or meth-P, okay, and we measure their mood. So this may be a drug that's going to help with people that are having issues with depression, and we give them the drug and we measure their mood, okay. We do a mood chart. We do some type of chart to turn it to numbers. So they give a number on how they feel, and we measure that over time, okay, and then we come up with the average mood number that we get for each group. So what we want to know is, let's just pretend that the meth-P is much cheaper than the psilocybin. Okay, the meth-P is much cheaper than the psilocybin, and then we have the placebo. Okay, so the first thing we want to know, do these drugs increase or change the mood of the people taking them? What do? We look at this. Now, if we don't have error bars, we just use the average. But if we have error bars, it's more accurate. We can see if there's overlap. So, does psilocybin and meth-P improve the mood of people taking these drugs? And the answer is yes. And the reason we know is because here, okay, these don't overlap. These error bars don't overlap. So psilocybin and meth P significantly increase the mood of people taking it compared to the placebo, okay, compared to the placebo. But the next question is, the meth P, I said, was much cheaper than the psilocybin. So does it matter whether they get meth P or psilocybin? And the answer is no, it does not. Okay, it does not. Because even though it looks like psilocybin increases their mood more, there's no statistical difference because these error bars overlap. So your interpretation of this graph would say, 1, taking meth P and psilocybin does increase your mood statistically over taking the placebo. And the second interpretation would be, but there's no difference between taking the meth P and the psilocybin because these error bars overlap. So if it comes down to cost, you're going to give them the meth P because it doesn't cost as much. Okay, we'll go over that and we'll practice it. But the other thing I want to reiterate to you is the difference between a blind and a double-blind study. Okay, so you want to add some notes here. So a blind study, we do this because we don't want the patient to know what they are getting because it will make a difference. Okay, it will make a difference. For example, if I was going to do something with you guys and I was going to give you a supplement and we were going to do a weightlifting program and I wanted to see if the supplement would help you get stronger. Okay, if you knew whether you were getting the supplement or getting the placebo, the group getting the knowing they're getting the supplement would improve more, and the placebo probably wouldn't work as hard in the weight room because they know they're not getting it. So what you have to do is you can't tell the people what they are getting. That is a blind study, that the patients or the subjects in your study do not know what they are getting. That is the blind part of the study, okay? And I will tell you, even in cancer treatments, so you've got people that have cancer and they get into a study and they're testing a new experimental drug, they have to sign a big long contract. And one of the things it says in that contract is that they don't know whether they're getting the drug or the placebo. Okay? So that's one of the side effects of being, or one of the disadvantages of being in that study. The advantage is it could save your life. The disadvantage is you don't know which one you're getting. I will tell you, in a study like that though, if the drug is showing great improvement in the cancer, they will stop the study and then start giving everyone the medication. But they do that because in some cases, the medication can actually cause more side effects and death than the placebo. And so that's part of why they're making it a blind study. They want to make sure that what they are testing, what they are testing is actually doing it and not just the fact that you're getting something. Okay? Now, a double-blind study is when the subjects don't know what they're getting and the person running the study does not know what they're getting. So for example, if we were running a study using the supplement and weightlifting, if I know which one you're getting, then I'm probably, even subconsciously when we're in the weight room, going to push the people that I know are getting the supplement. Okay? So if they know they're getting the supplement and I know they're getting the supplement, then I'm going to be like, okay, you can go harder, blah, blah. Where if I know you're getting the placebo, I might not push you as hard. Again, it may be subconscious, but it's just because it's just the way human nature is. So a double-blind study is I would not know what you're getting and you would not know what you're getting. That way I would treat everyone the same in the weight room. Now, obviously, someone has to know what you're getting. So what would happen is, let's say Dr. Duke, I put her in charge. She would randomly put you into groups, randomly put you into groups. And then I would just give you, the placebo and the supplement would have to look the same. I would just give you whatever, I wouldn't know what I'm giving you. You wouldn't know what you're getting. Dr. Duke would know what you're getting, but she's not dealing with you, so she would not influence the study. Okay, so that's the difference between blind and double-blind studies. Okay, so we go over graphs, we go over blind studies. We will practice all of this throughout the year, but you will have a mini test over this information when we finish going over it.